topic today is about microbiology, and we will be discussing a genre of bacteria known as Staphylococci. To begin with, let's break down the name of this bacteria. First of all, cocci stands for the round shape of this bacteria, as you can see in this image, while staph stands for the clustered arrangement of this bacteria, as you can see again in this image. Now, the first thing we'd like to mention about this bacteria is that it's gram-positive, and this is usually done or obtained by performing a gram stain, which we will discuss in more details later on. The second thing to note about this bacteria is that it is non-spore forming, and spore formation is considered a virulence factor of bacteria, and what that means is that it makes it more pathogenic or more able to cause disease. Third, we mentioned that Staphylococci is considered beta hemolytic. Now, to further understand this, we can take a look at this image on the right. What you can see here is that we have this red media, and what this media contains is general nutrients as well as sheep blood. And obviously sheep blood contains red blood cells. So what we do is that we culture certain bacteria in this media and we look at the hemolysis pattern, or the pattern of breakdown of red blood cells. And if this bacteria causes complete hemolysis or breakdown of red blood cells, we say that it is beta hemolytic. If it causes partial breakdown of red blood cells, we say it's alpha hemolytic. If it causes no breakdown of red blood cells, we say that it is gamma hemolytic. Moving on, we say that this bacteria is also considered to be catalase positive. Now, catalase is a test that is performed and it checks the ability of certain bacteria to convert, as you can see here, to convert hydrogen peroxide into oxygen gas and water. And the formation of oxygen gas will lead to this bubble formation. And this would be very beneficial in determining whether a gram-positive bacteria is Staphylococci or Streptococci. And in this case, again, Staphylococci is the one that is catalase positive.
Right, now moving on to the classification of Staphylococci. So as we've already mentioned, this is a genre of bacteria, and this genre has three different species that we need to discuss. We start with Staph aureus, Staph epidermidis, and Staph saprophyticus. Now it is very important to know what are the tests that we can carry out to differentiate between these three species. Now to start with, let's say that we started here, and if you remember from the previous slide, we can perform the catalase test to differentiate between Staphylococcus and Streptococcus. And if we got a positive result, this means that we're dealing with Staph genre. Now what we can do next to differentiate between the species is perform coagulase test, and this test, as you can see over here, a positive result would usually yield this, which is coagulation in a liquid media, and the only species of staph that can actually produce this type of coagulation is Staph aureus. Now if we do have a negative result, this means that we're dealing with either S. epidermidis or Saprophyticus. Now this brings us to a very important question: how can we differentiate between these two species of bacteria? Now, the way to do this is through the novobiocin sensitivity tests. What it does is that it differentiates again between S. epidermidis and Saprophyticus, and what we do is that we look for the zone of inhibition. Now, to understand all of this better, we will take novobiocin. So what is novobiocin? It is an antibiotic, and we know that antibiotics can be used to kill certain bacteria or stop their replication and their growth. Say this is the bacteria. However, sometimes certain bacteria, they can acquire what we call resistance, and this resistance means that no matter how much I give this deadly substance to the bacteria, it would not be killed. Now what we can do is that we can use this to our advantage in this particular test. So we can get our unknown bacteria, I don't know whether it's S. epidermidis or Saprophyticus, and we can grow it in a certain media. A while later, we can insert what we call the novobiocin sensitivity discs, and all they are is basically discs that are, submerged in novobiocin antibiotic. A while later, we will come and we will see one of two results. Number one could be the development of a zone of inhibition. The zone of inhibition means that this antibiotic was successful in inhibiting the growth of this bacteria, meaning that we're dealing with S. epidermidis. The other result that we can possibly get is no zone of inhibition, meaning that this bacteria is absolutely resistant to novobiocin, and this means that we're dealing with S. saprophyticus. The last test I'd like you to know is the mannitol fermentation test. Now, in here we use a differential media, and what this means is that this media helps us differentiate between two different species of bacteria. And what we do is that we test the ability of certain bacteria to ferment mannitol, and if they are able to ferment mannitol, as you can see over here, the color of the media will turn yellow, as in the case with Staphylococcus aureus, and if they're not able to ferment mannitol, the color will remain pink, and this way we can conclude that we're dealing with Staphylococcus epidermidis. The first microorganism we'll discuss is Staphylococcus aureus. Now, it is also known as the superbug, as it causes a wide variety of diseases, and the first class of those diseases we'll discuss is related to the skin. Now, we have several different types, as you can see, and the first one is folliculitis, which is a benign infection of a single hair follicle, and it usually presents with no other symptoms. The second type is the furuncle, and as you can see here, it's a deep-seated infection of a hair follicle. And the last one, which is the more serious one, is the carbuncle, and as you can see, it is deep-seated infection of several different hair follicles, and it usually does present with generic symptoms such as fever, fatigue, and malaise. Another skin condition that's important to know is impetigo, which is also caused by Staph aureus. Now, this usually presents in children, and it presents initially as a small vesicle that becomes a pustule filled with pus, and then it ruptures. Once it ruptures, it will give you this appearance, which is where you have a red or erythematous base with a honey-clustered region, or legion on top. And I put this image of honey here to remind you of that appearance. The next complication of a staphylococcal aureus infection that I'd like you to know is the toxin-mediated diseases. Now, it's important to remember that Staph aureus can produce 3 different toxins. One of them is known as the exophyllative toxin, and this toxin in particular causes this disease, which is the staphylococcal scalded skin syndrome. Now, it is very common in newborns, and it usually begins as perioral erythema or redness around the mouth, and it usually gives you a positive Nichols-Kynes sign. This sign is a skin finding in which the top layers of the skin slip away from the lower layers whenever they are rubbed, and this is exactly what we can see in this image. It is also sometimes known as desquamation of the epithelium. The second toxin produced by Staph aureus is known as the toxic shock syndrome toxin 1, which causes the staphylococcal toxic shock syndrome. Now, this is very common in women in menstrual age, and it is associated with prolonged use of tampons. It is a multi-system disease that presents as fever, hypotension, and a rash that usually appears this way. Now, if not treated immediately, it is a fatal condition as it leads to end organ failure. The last toxin produced by Staphylococcus aureus is known as enterotoxin, and it usually causes staphylococcal food poisoning. It is said to be an intoxication, and what that means is that the bacteria produces its toxins inside the food, and then a certain individual consumes that food and gets intoxicated by that toxin. Now, it is characterized by having a rapid onset of symptoms, and the common signs and symptoms of food poisoning are vomiting, diarrhea, and abdominal pain. Now, there are certain foods that are particularly associated with staphylococcal food poisoning. Anything that contains mayonnaise, like potato salad or chicken salad, things that contain dairy, like ice cream, and certain cold cut meats, as you can see here. One final thing to touch upon related to Staph aureus are the generic invasive diseases. We won't go into the details of this, but it is important to remember that it does cause pneumonia, infection of the lung. It can cause septicemia, which is when bacteria reaches the blood, osteomyelitis, an infection of the bone. It can lead to abscess formation anywhere in the body, and it can also lead to endocarditis, which is inflammation of the endocardium of the heart. The second microorganism we'll talk about is Staphylococcus epidermidis. Now, the number one thing that I want you to remember is that it has the ability to produce slime, or what we call biofilm. And this biofilm will allow it to adhere to foreign substances or surfaces such as catheters, prosthetic valves, shunts, and grafts. And this is why you find it usually causing endocarditis in patients who have a prosthetic valve or a transcatheter, as in this case. And an additional thing to note is that this biofilm will protect it from phagocytosis as well as the inhibition by antibiotics. The last microorganism we'll talk about is Staphylococcus saprophyticus. Now, the main thing that I want you to remember is that it causes UTIs, and it usually causes what we call honeymooners UTI because it happens in young females after their first sexual encounter, and this is because there will be displacement of the normal flora in the vaginal area into the urethra, causing a urinary tract infection. And you also need to remember that it is the second most common cause of UTI after E. coli. That's it for this video. I really hope you guys enjoyed our discussion about the Staphylococcus genre. If you do have any questions, please do not hesitate to contact me, and thank you for watching.